So we call it to order. Madam Clerk, would you please call the roll?
Commissioner Marecki,
Here.
Commissioner Dobb,
Here.
Commissioner Anderson,
Here.
Commissioner Baker McCormick,
Here.
Chair Colleen.
Here.
We have a quorum present.
Thank you very much, and thank you everybody for your patience a little bit. Next on the agenda, Madam Clerk.
B, approval of the July 21st, 2020 meeting minutes.
Pleasure
So
of the committee.
moved. So moved, Marecki.
Thank you. And Anderson seconds. Any discussion, any corrections, changes to the minutes? Hearing none, all in favor of the motion, please say aye.
Aye.
Aye. Opposed? All righty. Madam Clerk, what's next?
Item C1, under old business, an ordinance by Commissioner Colleen to ensure the human and civil rights of all people are protected against discrimination of any kind in Wayne County by adding Chapter 55 to the Wayne County Code of Ordinances to be known as the Wayne County Human Rights Ordinance.
Thank you very much. I heard yesterday there was an outstanding question with Corporation Counsel, and I just got Corporation Counsel's response yesterday. And it was a question that Commissioner Marecki had posed, and I think you were on the email, Commissioner Marecki, to get the answer to that. And we have one other outstanding little issue that we're working with the realtors on. It has to do with, because this housing discrimination is forbidden in this ordinance too. But there's some technical language about sometimes before a sign goes up on a lawn for sale, there's like a pre-sale or something. So anyway, I've had a couple of realtors kind of question if that is the correct wording or not that we're putting in there, because we don't want realtors to be accused of something that they're not doing. So we have to have the wording right on all of this. So we still have a little bit more work to do. It's those two issues. Pretty much everything else is done. So what I'm asking for today is that we pass this item pass the item for the day, and I'm very hopeful that it'll come back ready for a vote in 2 weeks. But for today, we need to pass for the day.
Move to pass for the day, Anderson.
Support,
Thank you,
Marecki.
Thank you. Any other discussion of that motion? Hearing none, all in favor, please say aye.
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 Aye. Opposed? Any abstentions? All righty, thank you. New business, Madam Clerk?
Item D1, under new business, communication from Janelle Allen, Chief Operating Officer, forwarding notification of an emergency procurement with Memorial Healthcare.
All righty. And who do we have from the department to walk us through this?
Hi, everyone. It's Jennifer Caruso, Clinical Services Division Director, HHVS.
Welcome, Ms. Caruso. What are you asking us to do today?
I am asking you to approve an emergency procurement with Memorial Hospital to provide both PCR swab COVID tests and IgG antibody testing to all newly booked inmates at the Wayne County jail facilities.
Okay, what do we know about the level of these supplies over at the jail?
Sure. So I don't know if you are aware of this, but on June 2nd, Judge Kinney signed a court order that all inmates be tested, all newly booked inmates be tested
Right.
in the facilities. So we, looked for a local vendor to provide the server, but we were unable to secure that and find someone that was interested in doing so. Memorial Hospital has really stepped up to the plate and provided extensive services to us at both facilities. They have turned around results on the PCR and IgG antibody testing within maximum of 72 hours, where a lot of labs right now are taking anywhere from 3 to sometimes 7 days to get results.
Yeah.
So they have really stepped up to the plate. They are providing up to 60 tests per day, Monday through Friday. Most of the time we have about 40 to 50 tests per day, so that they can more than meet our needs for both facilities, Division 1 and Division 3, where the newly booked inmates are being processed.
Did Judge Kenny give a deadline for when you have to start that?
Yes, so we had to start on June 8th, and that's when we did start the testing.
But now you need more testing equipment and better, apparently.
Right. So what we've done is we started testing on June 8th. The original contract for Memorial ended on 7/31. We issued an RFI to get information from other facilities and organizations that may be interested in competing for that and submitting information.
Yep.
We received 2 proposals and information which were substantially higher than Memorial Hospital submitted, and they were not local to Wayne County. So we thought it was best to go with Memorial because we're aware of how they can process the specimens, and they're meeting all of our needs. They're adjusting all of the needs that we bring to them. As you can imagine, we had to get this up and running within a short amount of time. So we did have some bumps that we had to smooth out in the beginning, and they've been more than accommodating to us.
Okay, and they got the technical words in here, but for my colleagues, the PCR test is the polymerase chain reaction. That's to tell you if the virus is present. That's the test that says either positive or negative, you have the virus. And the other test is the antibody test, that maybe you've had the virus and you got the antibodies in your blood, and they might want to, in the delicate language of medicine, harvest that blood for treatment in folks that are currently going through COVID treatments. So those are the 2 tests. I'll start with the Vice Chair of the committee for any questions she might have on this contract. Commissioner Baker McCormick?
I have no questions.
Okay, and we'll go around the horn. Commissioner Anderson, questions?
No questions.
Okay. Commissioner Dobb?
Thank you, Mr. Chair. Is there a report that goes out on how many inmates are tested and how many are positive, negative? And then who does that report go to, and how often does it go out?
Sure, we have an extensive spreadsheet that we're tracking all of the results. Ms. Janelle Allen gets daily results of all of the tests. I also have submitted them to Judge Kenny at several periods throughout this, through the testing since June 8th. And I can rattle off some stats to you right now if you're interested in that.
Well, I don't like that verbally. Is there something you can send?
Sure.
That would have that on it?
Absolutely, absolutely.
And then I just have one more follow-up question to that. So we get the daily confirmed cases report every, about 5 o'clock every day. That breaks down the confirmed cases and deaths from COVID by communities in Wayne County. So the cases that are confirmed for the jail inmates, are those still counted for their place of residence, or would those all fall under Detroit, and would those not show up on the report that we get?
So any PCR positive coming out of Wayne County Jail is automatically uploaded into the Michigan MDHHS database for all positive COVID infections in the state. The Detroit Public Health Department is also receiving anyone that resides in the city of Detroit, and they're following up on those investigations. Okay,
but for an inmate, would like if if the inmate's home, their place of residence was in Canton Township, but they're being housed in, the county jail in Detroit, would their case be reported as a Canton Township case, or would it be reported as a Detroit case?
I believe they're reported as Detroit. I would need to get clarification on that from public health, however.
Okay. Okay.
And I can do that for you. I will actually follow up with Dr. Ruda and get an exact answer. I don't want to tell you something that is not accurate.
Okay. Thank you. That's all I had.
Yeah, and Commissioner Dobb, I wasn't able, given my issues today with communication, to get to the Ways and Means meeting earlier, but there was about $4 million, and I think all of you guys are in Ways and Means. There's about $4 million that was moved out of the CARES Act for our department in various categories that they're going to spend those COVID dollars. And I was going to ask today that at our next meeting that we get a rundown of where all of those dollars are going and how much of the COVID dollars do we have left. But I think at the same time, Commissioner Dobb, the kind of questions you're asking, because then we will have the health department before us. And so 2 weeks from today would be another good opportunity to be sitting with the county health officer and getting clarification on those questions.
All right. Thank you.
Is that good, Commissioner?
Yes. Thank you.
And I would also suggest if you're going to send us over this data, please send it to the clerk of this committee, which would be, S. Lewis at waynecounty.com, and then she can share it with the rest of the committee.
Okay, no problem.
Because sometimes if it just goes to one commissioner, it might not see everybody else. But if we send it to the clerk, she can get it around, and I would appreciate that. Commissioner Marecki, you have questions on this item?
Yes, I just have one question. In light of the news stories the last couple of weeks about people testing false positive, and when these inmates are in and they're incarcerated and they get a positive COVID test, are they tested again like the next day or the day after? Or are they automatically isolated? Well, they're probably automatically isolated if they have a positive test, but is there a follow-up to make sure that they really do have the COVID?
Sure. So any positive PCR test that we get a result from the lab on, those people are placed into medical isolation, and within 14 days, those individuals are retested by our jail medical staff.
Okay, but just an example of Matthew Stafford last week. He tested positive. The next day he tested negative. So is there any testing in between those 14 days to make sure they truly are positive?
Not at this time. We do not have something set up. And I'd be curious to know if Matthew Stafford, if they used a rapid test in his case. I haven't read much on that. But the rapid tests there are increased amounts of false positives with the rapid test. I'm not sure what they're using. But no, we do not have something set up for that currently. Okay, I'm going to look and see if they did mention the test. I don't know either. All right, thank you. You're welcome.
Well, and I think, Commissioner, that's something we want to pursue with our health officer in 2 weeks also. Do we know how many false positives we're getting in the jails?
I do not have that rate, no.
Does anybody have that rate?
Can I just add something? If someone is tested, if someone's tested positive and Jennifer says they're isolated for 14 days, they probably wouldn't even know if they had false positives if they didn't do another one a day or two later after the first positive.
Right.
You know what I mean?
Well, and I think that's what we want the health officer for. I mean, is this a question of money? How many tests we can do? What's the limiting factor here? And another thing that I'm still not certain about, is originally the CDC just let any test get out there. American made, coming from overseas. We had a few different hundreds of these going back to March. And the CDC was not testing the accuracy of this test before they allowed them to get out to the community. At that time, the CDC just said, yeah, get out there and sell them. And I know that they've kind of got a list right now, and it's maybe like 70 or 75 companies of, no, we're no longer using these tests in the United States. So I don't know, how many tests are in the pipeline that we know are rather shaky. But I think, Commissioner Marecki, you raise a good point. I think in a couple of weeks here, I want the committee to have a better understanding of how many false positives there are. Why is that? The different kinds of tests that are likely to give you false positives. Because in the middle of everything else, right, to have a bunch of false positives out there is not helpful at all. And so, yeah, we'll want to talk about the jail and how frequently we test, and what's the limiting factor to that. If right now we're only doing it 14 days apart, because you raised the right issue, I think, Commissioner Marecki. So I'm sorry for stepping on you. Got questions still, Commissioner Marecki?
No, I think that's it. Thank you.
Okay. Well, what's the pleasure of the committee then on this item?
This is a file item, Commissioner.
I will move to receive and file. Daub.
No, we're not receiving and filing this.
This is item number 1.
Yep. This is spending $330,000 to get more testing equipment in the jails, or tests.
Well, it says that this is forwarding notification of an emergency procurement. Emergencies only come to you to be received and filed. The action has already taken place.
Of an emergency procurement.
Yeah.
Oh, my bad in reading it. I thought they were asking for an emergency procurement with our vote. Okay, so this has already been done.
Yes.
All right. So I'm sorry, Commissioner Dobb, your motion to receive and file is exactly accurate. Maybe not, maybe even more accurate than the tests are. Commissioner Anderson, was that a second?
Yes.
Okay, so we have a motion and a second to receive and file. All in favor, please say aye.
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 Aye, opposed? Abstentions? Yeah, all this trying to get my communication stuff right has got me a little thrown off. What's next, Madam Clerk?
Item 2, requesting commission approval of a retroactive cooperative operational agreement with Wayne County Healthy Communities.
Okay, and this is to create the board over there. And in this case, they're requesting our approval. So somebody from the department introducing this item about the Community Health Center Board.
Sure. It's Jennifer Caruso again from the county. I also have Tom Kochis and Brian Middow on the call as well from the FQHC. So I will allow Tom Kochis to speak at this time.
Mr. Kochis, always good to have you with us.
Thank you for
what do
that.
you need here?
I hope everyone is staying safe. This is our annual 3-year renewal of a cooperative agreement with Wayne County. This particular one basically spells out how Wayne County will get the primary money from the grant, and under the rules of the HRSA and creating federally qualified healthcare clinics, they have to have an independent board and an independent operation from the county. So this defines all that with no changes from the previous 3 years. You're right, this helps define the board. As some of you might be aware, but our board is a board of people that utilize the clinic. At least 50% of the board members are patients, and very few of the board members, only 10% could come from the healthcare community. So we have a very patient-focused board, which utilize our services. This is, again, the support, what we can expect from Wayne County and what we do for Wayne County in return. I don't know if anyone has any questions. As I stated a little bit ago, it's the exact same agreement we had for the last 3 years. I believe Ms. Allen as well as Ms. Caruso have reviewed this as well. So any questions, I'll be happy to try to answer them.
Yeah, I got a couple right off, Mr. Coaches. These are federally qualified health centers. And is it the federal rules that lay down who is to sit in categories on a health center board?
Yes, it is the rules, the guidelines of the HRSA when they provide the dollars for federally qualified healthcare clinics. That's correct.
Yeah, so they proscribe at least categories of who needs to be on those boards.
That's correct.
And also, please explain, in a legal sense, this is Wayne County Healthy Communities, that's you, but this is a legal document between the County of Wayne and the Wayne County Healthy Communities. So please explain why Wayne County Healthy Communities isn't like a department of Wayne County government.
Wayne County, you have to be an independent operation that can't be overseen by the government, but must have representation by the grant holder, which, since this is a co-applicant agreement, Wayne County, getting the dollars, has the lead person that answers to the board, and that would be Ms. Caruso, who is the Division Director of Clinical Services, been in the same, also wears the hat of being the lead CEO of Wayne County Healthy Communities. Wayne County Healthy Communities is a separate 501c3 corporation, which was developed or became a corporation just for the services provided with Wayne County. The rest of the, I'm sorry.
No, I was just going to say, I think people conflate the two. They hear Wayne County Healthy Communities and they think that's the county. So I just wanted to help people understand that.
We are a separate not-for-profit corporation, which runs and operates just the clinics. We actually try to get our own philanthropic support whenever we can. But at the same time, we would not exist without the Wayne County grant, because that's the majority of the dollars specifically given to Wayne County and to develop clinical programs for the underserved, both in the communities, primary communities of Hamtramck and Southern Wayne and Northern Romulus, even going into Westland, Southern Westland, and the western part of Inkster in Wayne County, all in Wayne County. We also get, at the Hamtramck location, we do draw from Highland Park. And be aware that we turn away no patients. And so if a patient comes from Detroit or from Warren, they're still seen in the Hamtramck Clinic if they want to be. If a patient comes to us from, let's say, just outside the Wayne County border in Ypsilanti and wants to be seen at one of our clinics, we still see them as well.
And this may be just a little off topic, so I'll take a quick answer. We might want to talk about this a little bit more at a future meeting. But Michigan now has been an approved state for that legislation that Senator Stabenow got 3 or 4 years ago. I forget the alphabet soup. It's like the CCHBC or something. Community-based healthcare with mental health and physical health. I forget the name for it, Mr. Coaches.
I do as well. I'll go with alphabet soup.
Are we going to be able, our FQH, not ours, is the Wayne County Healthy Communities. Are they going to be able to take advantage of those dollars?
We can investigate into that. We have not at this point in time, although we do offer full behavioral health services at both our clinics, and we offer clinical psychologists, and we have a contractual agreement with the Wayne State University psychiatric group, the UPG group, to provide psychiatric services. At this point in time, we're working with SAMHSA money to provide those services, as well as our general grant, Commissioner Colleen. So we can
Yeah.
follow up on that to see if we would qualify. In a sense of transparency, we're just trying to do as much as we can for the population we serve right now. We know
Yeah, I got you.
services are.
I do think I want to talk about it in the future, though, Mr. Coaches, because I believe some of that funding would go to 24-hour operation. So I don't want to get into that now, but okay.
Okay.
So on the approval of the retroactive cooperative agreement between the county and Wayne County Healthy Communities, we'll go to questions from committee, and we start with the Vice Chair, Commissioner Baker McCormick, for questions.
I have none. Thank you.
Okay. Commissioner Anderson, questions?
I'm all set. Thank you.
Oh, thank you. Commissioner Dobb
No questions for me. Thank you.
and Commissioner Marecki.
I'm all set, and I will move approval.
Support Anderson.
Thank you. And support Anderson. All right, proper motion before us. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? And no, you got to be on the committee to oppose it. Are there any abstentions? Okay. Thank you very much. We love our FQHCs and providing just such vital services out there. So thank Healthy Communities for what you do.
Thank you for the
Madam
support.
Clerk?
Thank you for the support, commissioners.
Okay, yes.
Thank
Madam Clerk, what's next on our agenda?
D, such other matters as may be properly submitted before the committee.
Well, I'm just going to make a comment here. I alluded to it earlier. We did not get at this meeting what we have gotten at the last couple, which is an update from our health officer on all things related to COVID. I think with the action in Ways and Means today and the $4 million and some change that we're going to use CARES Act money to beef up our COVID response in the county. I think I'm going to be asking, I'm going to be asking that the health officer join us next time and give us a little report on those CARES dollars and where they're going and what they're going to be used for and how much is left in the pot. But I think a few of the other questions that came up today on testing, on whether if somebody dies in the Wayne County Jail, what city are they, assigned to where the death is on the reporting, that we can get those questions answered. So I'm going to be requesting the health officer give us a COVID report at our next meeting. And any committee members that want the health officer to report on something specific, please just give me an email and then I can prepare the health officer for what questions are going to be asked. So, but we'll do that at the next. Other than that, does anybody have some such other matters? Hearing none, we'll roll the, yes.
Chair Colleen, this is Nellie Lee from HHBS. If the committee members don't have any questions, I would like to respond to your request.
I didn't catch your name right at the beginning.
Nellie Lee, HHBS Policy and Compliance Director.
Okay. And what would you like to respond to here?
Well, I just wanted to let you know that I will be communicating to Carol Osterberry and Dr. Sharon Pani regarding your request. I will field that to her so she'll know that that is coming. So I just want to let you know that we will relay that message because I don't think she's on this call.
Okay, yeah, and thank you. I didn't know if she was or not, and but I'm going to follow up with an email too. But if you'd mention it to her that it came up in committee, that would be great. I'd appreciate that.
Not a problem at all.
Thank you. I didn't hear some such other matters. So what's next on the agenda, Madam Clerk?
Public comments?
Did we get anything? Does anybody know anything emailed in?
No emails were received.
Okay. So we don't have public comment then, correct?
Unless there's someone on the line who has a comment.
Okay. And Ms. Lane, how do we do that? How do they know? Do they have a way of raising their hand?
Yes, I don't see anything in the chat.
Okay.
And you can always speak up if there's a comment at this time, they can.
Okay. So everybody heard that. We're open for public comment. Does anybody from the public have comment for the Health and Human Services Committee today? Is there anybody out Zooming in with us that has public comment today?
We may
One
want to
last time.
line.
Okay. Yeah, things get a little more complicated, Zooming and such. Any member of the public have comment for the committee today?
Mr. Chair, you might want to ask the clerk to unmute everyone.
Yeah, I unmuted everybody on the line.
You did already?
Yeah, she did say that, yeah, a minute ago.
Thank you.
Thank
So-
you.
So it's been open. I think I've asked twice since it's been open. I'll ask one more time. Any member of the public out there wish to have comment to the Health and Human Services Committee? All right, I'm going to make the call that there is no public comment for today. And what's next on the agenda, Madam Clerk?
Adjournment?
Pleasure of the committee.
Move to adjourn. Doug.
Support.
All right. Hearing no objection, the committee stands adjourned. Thank you, everybody.
Thank you.